There has been very limited research done in the area, and it is a very emerging topic with a lot more funding needed to do more research in the area so we can better understand it. With everything, we would start with looking at someone's lifestyle and seeing if we can improve it. Then also looking at behavioural therapies, so how we can better cope with the emotion and psychological problems that we're faced with in that time. It's a bit more nuanced in this, but you know, if the symptoms are quite severe in the 2 weeks before your period, then it's looking at working ways, you know, working from home, is that an option? And making sure your employer's aware, and actually, you know, not instantly responding to messages or emails. So it's looking at how your thoughts can affect your behaviour and how we can change that. So behavioural therapies can be quite effective for some women. And then SSRIs can be effective. Now, SSRIs are an antidepressant. They're selective serotonin reuptake inhibitors. SSRIs have been proven in studies to improve people's symptoms, so that can work for some people. And then the combined oral contraceptive pill can be helpful to some women as well. Some people can be quite sensitive to progesterone, and therefore there are other combinations of hormones that can be used. And then further down the escalation ladder, like I've mentioned in my journey, having Zoladex or GnRH analogues, which put you into basically a medical kind of menopause, that can help some women. And you would expect, if you're not having a cycle and your symptoms are worse than the 2 weeks before your period, then your symptoms would improve. So we would, because of the risk of not having your period, depending on your age, we need to put bone protection and give hormones back. That can sometimes actually trigger the symptoms to be worse again if we're giving add-back therapy. There are different regimes that we can give for that. The last therapy would be looking at removing the womb and the ovaries for last resort for some women, and people have had that done because of the severity of the symptoms. But for me, looking at lifestyle and really bottoming that out and actually seeing exactly what people can do and focusing on that, in addition to looking at other measures that can help in the meantime, is paramount. And I think a lot more evidence is needed around how we can utilise lifestyle to help with PMS and PMDD.